One of the reasons why it's very important that you know about this, that if, as you said, if any of you decide at some point that yes, you would like to refer patients to CMEs, at least you know what that's going to mean. Okay, it's not going to be a question of the patient comes back and say, where the hell did you send me? I was so unhappy. Okay, when I refer somebody, it's in good faith, and you hope that the patient comes back and says, I'm so glad you referred me there. They did X, Y, Z, and blah blah. I mean, that's the kind of referral you want to. Then they come back. So I think that's why it's very important that you know about this. And I think it's very important to actually, in dentistry certainly, and I think I suspect in any health field, is to have to manage people's expectations. Because it's so easy to feel you can do everything. Yes, you want to do everything. And the number of times I have to stop when patients are doing X, Y, Z to just say, okay, we'll start treatment. I said, no, talk about it first. Talk about it first, because it's so easy for me to just get in and start doing work. And if I haven't talked about it, I may have done the best job clinically, but the patient may be unhappy because you have not managed their expectations. You have not ever talked about it. So I think it's very important that we manage expectations as well as hopefully we try and exceed them. So again, I think this is the part of what I did in my early years. I think in the first basically 8 or 9 years, I attended a series of courses, year after year after year, after graduation, just to improve my skills. And I was feeling like, I can do everything, and then came homeopathy. And suddenly I thought, this is a perfect marriage. Yeah, it's just so thrilling. It's so nice to actually see that there are things we can do in other ways that can help patients. So I think looking at the 300 degrees view, patient always comes first, and then the dental health. So if you don't understand the patient, you're wasting your time. Listening and understanding to patients' lifestyles, diet, general health concerns. We'll probably cover a little bit more about that shortly. Providing enough time and space for discussions, questions, so that the decisions are made jointly. That's what we call, I'm sure it's a very sort of easy word, co-diagnosis, co-treatment planning. It's almost as you're talking through, you know what the patient wants already because of the body language and what they're talking about. And then you just finally ask them the question and they'll say what it is. Certainly, again, identifying potential problems and trends, because dentists have trends, and when you look at a patient, we have a medical history form which patients fill up. It's two-sided, and there's a little extra piece of paper. By the time I actually read through that, I know what I'll be finding. And the day I don't find it, the first question is, tell me, when did you change your habits? Okay? Because if they're doing a lot of the right things, and I find all the wrong things in the map, that has to be an explanation. It didn't just happen. Okay, so I just turn around and say, tell me a little bit about any changes that you've made in the last year or two. And it almost comes out. Okay. So